Good afternoon, everyone. My name is Saif Badran. I'm a plastic surgeon at Washington University School of Medicine, and I'll be talking to you today about metabolic changes after body contouring surgeries. No disclosure. So the outline of my presentation today, I will start with introduction. Then I'll speak about phases of our project. And then I will finish it with a summary of our research finding. So we all know that abdominal central obesity is bad. And all these projects that have been displayed so far, it's like basically we're trying to understand what causes the metabolic harm of obesity. We know a lot of patients are obese with high BMI, and they are insulin sensitive or metabolically healthy. On the other side, there are patient population named lipodystrophy, where they have like almost zero fat in their body, but they are extremely insulin resistant. So it's not just about having bad, it's about understanding how this fat causes these metabolic problems in order to be able to produce some solutions and treatments. So abdominal obesity is bad. However, when we speak about abdominal obesity, which is a component of metabolic syndrome, abdominal obesity encompasses visceral and subcutaneous tissue. Visceral is only 20%, and most of the study looked at the visceral fat as the source of all these pathogens, mainly because of portal circulations, meaning that this visceral fat is connected directly to the liver and can cause more harm. However, recent study showed that the metabolic effect is a shared effort between the subcutaneous and the visceral at the same time. We all know we're living in a pandemic of obesity. At the same time, our lifestyle makes it difficult for us to lose weight. And with the current increase in the market for the GLP agonist, this has produced a significant demand for surgical interventions to improve the body shape in no time. When we speak about surgeries for obesity, I'm not promoting plastic surgeries as a surgery for obesity. So we have two types of surgery. We have the bariatric surgery and we have the plastic surgery. If we want to take a deeper look and compare these two types of surgeries, the idea behind it is to understand mechanisms linking obesity and insulin resistance and metabolic syndrome. When we look at bariatric surgery, it targets the root cause of obesity by decreasing the energy intake. These patients lose significant amount of weight, but it's gradual. And the number of adipocytes is the same in their body. They only have decrease in the size of their adipocyte. On the other side, plastic surgery as body contouring, these patients, they lose moderate amount of fat. However, it is sudden in one day. These patients lose 2-3 kilograms in one day. The size of their adipocytes is not changed, but the number is changed. And only the subcutaneous fat is removed during these surgeries. While in bariatric surgery, they lose fat size in visceral and subcutaneous. So we're speaking about different entities. So what really, there's a lot of studies speaking about metabolic changes after these plastic surgeries, but we still don't understand the independent impact, what's the magnitude of this change, and what's the durability of this change? For how long does it stay? So we started our first step conducting an umbrella review. Basically, it's a systematic review of previous systematic reviews and meta-analyses, trying to understand what is currently known about the metabolic changes after body contouring surgeries. And we found that these changes is categorized into 3 aspects. First, which is most important, is what's the impact of these surgeries on insulin resistant? Most of the study they were inconsistent in the findings. And there was a trend toward improvement in insulin resistance. However, they did not report what is the magnitude of this change and for how long. Looking at the changes in the inflammations, also studies were inconclusive, but they showed some sort of trend towards the improvement, but it wasn't clear for how long or how much. Third, looking at the changes in the adipokines, and we found there is improvement and decrease in the leptin level after these surgeries. However, how much is the improvement and for how long, we don't know. So that brings us to the second step. We looked at all these studies. They have different timelines. Some studies looking at the change in 2 weeks, some study looking at change in 1 month, some in like 6 months. You can't just combine them and say there is no change. So we did dose response meta-analysis, meaning all these studies, each study contribute to its own timeline. So some study looks at the change in 2 weeks, some 1 month, 2 months, 3 months, 6 months. Then we want to look at the trend and the magnitude. We categorize the outcomes into several categories. We looked at the changes in body composition, adipokines, glucose homeostasis, inflammation, lipid profile, and even blood glucose and blood pressure. First, we looked at the change in the body composition. So the graph shows clearly these patients after body contouring surgeries, they lose weight. Their BMI drops, their weight drops. But there is like a trend going down by 2 weeks and coming to their baseline by 6 weeks, which means these patients, after they go and let's say they get tummy tuck and they lose like 2-3 kilograms of their belly, in 6 months, if you go back and you measure their weights, it's almost same as before surgery. So they regained the weight. Let's look at the changes in the leptin. So we found the only marker that changed after this surgery was leptin, and it followed the similar trend. I just want to highlight we got this info from different studies, and they still showed the similar trend, that leptin goes down for a couple of months and goes back to the baseline by 6 months, which confirmed the power of this study. Let's look at the change in glucose homeostasis. Here I want to separate 2 things. First, if you look, and this is like extremely interesting for me. The first one was the change in fasting insulin, there was no change. But if we look at the change in the HOMA, which is a marker of insulin resistance, it didn't follow the same trend. It continued to go down by 6 months, which means these patients, even that they gain their weight back by 6 months, they gain it in different areas that is more metabolically healthy. And this has been reported that patients, for example, after they get plastic surgery, like a tummy tuck, their breast size gets bigger. Why? Because when they regain weight, they don't regain it in the same area. They gain it in other area, which could be metabolically healthier. Change in inflammation. It was very small, but following the same trend. Change in the lipid profile. Also, if you can see, the HDL followed the opposite trend, while the LDL was the total cholesterol following the same trends. So all these from different studies, different timelines, but showing us the similar trend, except for the improvement in the HOMA. Even the blood pressure, we know that if you lose around 10 kilograms of your weight, your blood pressure will get better. And we found similarly that these patients, their blood pressure, even it's like 2-3 degrees. I'm not saying it's clinically significant, but I'm saying this is empower our finding, that they lose 3 kilograms, their blood pressure goes down by 3. They regain these 3 kilograms, their blood pressure goes back to the same level. Then we looked at something different. What about non-surgical body contouring procedures, such as fat freezing or ultrasound, all these procedures? Do they have the same trend? Unfortunately, there wasn't enough data to conduct these dose-response meta-analysis on them, but we showed clear improvement in their body composition after these procedures. But that was only for limited time, like a couple of months after surgery. We look at the changes in their other metabolic markers, and we only find enough data about the change in their lipid profile. And those patients, after non-surgical body contouring procedures, they got worsened lipid profile in the first 2 weeks. But this needs further studies. So to conclude our research findings so far, if I want to say like one finding that was like extremely interesting for me is the improvement in insulin sensitivity after body contouring surgery for at least 6 months for at least 1 HOMA degree. This brought us to the next step, is that what is the current gaps and what are the suggestions for future studies? So we found that, yes, it seems there is improvement in insulin resistance after these procedures. However, these reported studies are extremely heterogeneous in terms of the population. The population, some of them are diabetic, some of them are not. Some of them have high BMI, some of them are not. Some of them have history of obesity surgery or bariatric surgery, some of them are not. And these are significant confounders on these findings. So what really remains, the gap here, is we want to understand the independent impact of these surgeries, irrespective of these other confounders. Here, I want to just clarify one point for my coming slides. Is like we really need to understand the differences when we speak about glucose homeostasis or insulin resistance. Glucose homeostasis is basically the glucose level in the blood. And it has 2 arms. First, the beta cell function, which secretes the insulin. Second is the insulin resistance, which basically the action of the insulin on the periphery. So we want to differentiate the impact on each of these. So next, what we did, we conducted a clinical trial for patients, around 40 patients. These patients, they underwent body contouring surgeries, tummy tuck, no liposuction. We got blood samples before 1 week, 6 weeks, 1 week after surgery, and 6 weeks after surgery. From these blood samples, we measured the glucose homeostasis. We got them the oral glucose tolerance test, and we measured the HOMA-IR, which is a marker of insulin resistance. Here you can see the 2 hours oral glucose tolerance test, basically to give us like an idea about the glucose homeostasis, and we measured the HOMA-IR as a marker of insulin resistance. So I'm just going to highlight here our findings. So the most interesting findings when we looked at the independent impact of tummy tuck or body contouring procedures is an improvement on their insulin resistance. But it wasn't, we didn't see any improvement in their glucose homeostasis. On the other side, when we looked at history of obesity surgery or bariatric surgery, patients who had bariatric surgery had improvement in their glucose homeostasis without effect on their insulin resistance, which means patients who had history of bariatric surgery have better beta cell function. And this has been very interesting for us. And when we looked at the literature, it has been reported. Patients who had bariatric surgery before, even before they start to lose weight, their insulin resistance improved. I mean, glucose homeostasis improved, which means their beta cell function get immediately improved after these bariatric surgeries. What's the mechanism behind that? I'm not sure. It could be something related to incretin hormone secreted from the gut. And here comes the beauty of the GLP agonist medication. And these changes that I reported, it's extremely independent. So we conducted logistic regression to look at the independent impact of body contouring surgeries and bariatric surgery. Other research outcomes during this project, we validated what we call, Doi is my supervisors, my PhD supervisor, Professor Suhail Doi. Basically, we validated a measurements called the Doi's weighted average glucose and as a measure of the oral glucose tolerance test. So we all know the oral glucose tolerance test, where we usually go for the thighs measurements, basically measuring the area under the curve. What we did is like we took 3 time points, GTT at 0, 1 hour, 2 hours, with a certain calculation. All this curve was shortcutted in one value. And this value was used to categorize glucose homeostasis into 4 levels. We also did studies looking at the changes in Tanita scale, basically to look which measurements in the Tanita scale can be used to detect the changes in the fat mass after these surgeries. And we found that the only 2 factors in the only 2 elements in the Tanita that they reported any change was fat mass and fat differences. Currently, also, what we're doing, so during these patients, when they went for surgery, we got their consent to take fat samples for the same patients from their abdomen and thighs at the same time. We took the progenitor fat cells from these 2 locations, and then we grow it over like few weeks. Then we froze the samples, and we measured the differences. We found that the thigh fat, it's better in terms of adipogenesis, and that could be the reason for the difference in the metabolic effect of having the same amount of fat in the thigh or the abdomen. I just want to highlight like one point also that to me was extremely interesting. During our study, when we looked at the changes in HOMA-IR or insulin resistant after body contouring surgeries, we correlated the amount of change to the amount of fat removed from these patients, or the amount of fat percentage in their body removed. And we found no correlation, which means even removing ½ kilogram or removing 3 kilograms, they both had effect. What does that mean? Our hypothesis is not just about how much fat you remove during these surgeries. It's about removing hypoxic and bad fat. And these surgeries, like some patients, they will have only small amount of abdominal fat that get removed after surgery, while other patients, they will have a lot of fat and all of it get removed. So it's not about how much fat you remove, it's about removing the bad fat that doesn't receive enough blood supply, and that's the factor that generates more inflammation and will result in a clinical phenotype of metabolic syndrome and insulin resistant. So I would like to thank you all for listening, and thanks for having me.